Welcome back. Montefiore is celebrating 50 years of the postgraduate physician assistant surgical residency program. Here to discuss the residency program is Chief PA and Program Director Ben Philip. Ben, thank you so much for joining us.
Thank you for having me.
So, Montefiore's physician assistant residency is the oldest postgraduate residency program in the country. I think that's pretty amazing. Can you tell us more about the program?
Sure. So this all started in around 1970, where the chairman and vice chair of that time, Dr. Rich Rosen and Dr. Marvin Gleedman, had a vision to have providers that would be mainstays for the surgical services that they were in charge of. As you know, surgical residencies, they have residents going through rotations 4 to 6 weeks at a time, and there was really no mainstay in those surgical services. So they had a vision to have providers to be the backbone of the surgery services. And so their efforts took them to Duke University in 1970, which was the first PA program in the country. And they recruited 4 PAs to take back with them to the Bronx and started training in 1971. And their vision was to have them alongside the MD surgical residents. So it started out as a 4-year program, and they quickly realized, hit a bit of a kink, and with regards to the length of the program. After 4 years, they realized that these PAs developed into junior surgeons, and so that was a little bit of a problem. So the program length turned from 4 years to 2 years, and now, as it is, 14 months. And the goal of our program is for our PAs to achieve the highest level of surgical proficiency in such a concentrated time frame.
So, for someone who probably doesn't know, what role does a physician assistant take on in the medical world?
Great question. So it's equivalent to being a first or second year MD surgical resident. And what that means is they're pretty much the point person of that surgical team. They learn how to take care of patients on a day-to-day basis, involved in care, coordination of care, interdisciplinary team rounds that involve social work, case managers, and other services involved in the surgical patient's care. They manage surgically critically ill patients, and be able to provide compassionate, effective care to this diverse group of people. They also first assist in surgical procedures, which involves positioning, exposure, hemostasis, and ultimately anticipating the needs and the steps of the surgeon that they're operating with. And they're also involved in research.
Oh, okay, thank you. So, what are some of the areas this program focuses on?
Yeah, so we start out with a 2 month. We start in September every year, and we start out with a 2 month didactic period. Following the didactic period, we have clinical rotations, 10 rotations, and so they're comprised of 2 months of general surgery, 2 months of vascular surgery. There is a trauma and surgical ICU component where they rotate through Jacobi Medical Center, which is a level 1 trauma center. They're involved with minimally invasive surgery rotation, where that's mostly bariatric surgery, like weight loss surgery. They have an ambulatory surgery rotation, which is located at the Hutch campus in the Bronx. And that's your bread and butter general surgery, hernias, gallbladders, and same day surgeries. And also they have transplant surgeries. They're involved with kidney transplants, liver transplants, and going on procurements to different institutions. And they also have 2 elective rotations where they can choose any surgical specialty of their choice.
Oh, okay, and I'd like to know, do they well, you just said of their choice. I was gonna say, like, do they get a choice to, like, pick which field that they're most interested in?
Yeah, they can repeat a rotation that they loved, or something that really isn't on our mandatory rotations. Like plastic surgery, cardiothoracic surgery, something that piqued their interest during their time here. So.
Okay, interesting. So, how does it feel to be part of a program that has reached such a huge milestone, considering many hospitals face so many challenges during the pandemic?
It's a tremendous achievement, and to understand uh, that achievement, you have to understand that postgraduate training in itself for physician assistants is totally optional, right? They graduated from PA school, and from PA school they can go work in a job making six figures, or they can go for further training, such as our program, a residency program, training program, making half that amount, but for the sake of being specialized in surgery or ER or critical care. In Montefiore, we have the surgery program, and it's an intense program, but gratifying that they are proficient in taking care of surgical patients. That being said, eh, you know that is a huge hurdle. But that being said, we've had over 450 graduates from our program, and COVID, as everyone knows, was indeed challenging. Um, Earlier in the pandemic, when elective surgeries were postponed or deferred, PA students, while they were on their surgical rotations, did not really have the ideal surgical rotation, and so that uh, that made our program, a residency program at Montefiore, quite ideal for these patients, for these PAs that really wanted to pursue a career in surgery. And so, case in point is our incoming class of 2021. We had about 48 applicants for only 6 spots, and so a lot of people had to be on the waiting list, and it was a good problem, but it was challenging, definitely.
Right. Good problems to have.
Yes.
So, according to the website, in this program, you will obtain three elements: knowledge, judgment, and technique. Can you tell me more about that and the commitment to train reliable PAs?
Yes. So knowledge of surgery. Like I said before, September we start every year, and we start out with the didactic. And the purpose of the didactic is to, um, start the training of surgical knowledge. And we achieve that through um, various faculty and staff PAs that provide talks on surgical diseases and topics that they will encounter in their clinical rotations at Montefiore. We have hands-on labs for suturing and laparoscopic skills at our minimally invasive surgery lab at Montefiore. Um, and we have simulation labs to place special lines, catheters, and training in our EMR, which is Epic. And November onwards, when they are in their surgical rotations, they attend educational conferences as they go, to get that knowledge aspect. The technique, we preach the art of first assisting, which is suturing, positioning the patient, exposure, hemostasis. At a given time during their training, the PA's residents will assist about 20 to 30 surgeons, attending surgeons. And so they have their basic approach, but they also have their variation of technique and certain instruments that they use and things like that. And now the PA residents, after going through this, they'll have that in their arsenal as they pursue a career in surgery to refer back to. So in a given year, they assist in about 150 cases per per resident, and that's plenty of experience to achieve and fine tune their technique. Judgment is knowledge and technique. It combines knowledge and the technique they attain. It comes by experience. Judgment we mean by how to decide on managing a patient's condition. Deciding on what technique to use in the OR, and ultimately deciding if a patient needs a surgical procedure or not. So these three elements are our three pillars of this program.
Now, how can those that are eligible for this apply? And, what are the steps? What are the steps and some advice you'd had for people who are interested?
So The first thing is they need to be accredited. They need to graduate from an accredited PA program, and we accept applications as early as December. That can be found on our website. It's an application and also a personal statement on what made you become or wanting to become a surgical PA. And we have mandatory references and transcripts that they would need to send. We usually interview in February, March, and give decisions out in April.
Now, where can people go to learn more?
We actually have a Montefiore website. I think that'll be posted shortly, and there's a brief blurb of our residency program, and as well as contact information, and as well as our application is all on that website.
And then lastly, what is, I guess, a quick piece of advice you have for these aspiring students?
If you're interested in surgery, just be a sponge. Be a sponge while in PA school. Live, breathe, and eat surgery. Know why you want to go into surgery. It's not just for the money, but also taking care of these critically ill patients, and especially in the Bronx. The diversity of patients that we see, as well as the complex issues that they have, make it challenging. But it takes a uh, certain type of person who's willing to go through such a rigorous and intense training program like Montefiore, to be the exceptional and fully trained surgical PA that you can be.
All right, Ben, thank you so much for joining us.
Oh, no problem. Pleasure's mine.
That's all for our show today. Thanks for tuning in. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always.